Welcome to another edition of the About Mansfield Consumer Advice Series. I'm your host, Steve Cosio. We appreciate you being here today. And as we do on our regular basis, to my right, that would be your left, Dr. Joseph Adams. Welcome back, Calibration Chiropractic and Functional Health.
Thanks for having me, Steve.
Today we are continuing our series on concussions. And for those who want to go back you can either go back to YouTube, LinkedIn, Facebook, or listen to the audio on your favorite podcast platform on any of the episodes on concussions. Today we're focusing on adolescent concussion versus adult or even senior adult concussions. And Dr. Joe, again, let's just jump right into it. I would assume the treatment is different between adolescents and adults.
Yeah, so it's not necessarily that the treatment's different, it's that there are different factors that you kind of have to watch out for in the different groups. And so if you take an adolescent, because we see a lot of teenage concussions from sports, we have to understand, what it's like being a teenager. And, the first thing that I realized early on in, my career doing this is that, kids in school have a lot of stress. Right?
No, really?
Yeah. So they've got stress, and most of that stress is around, homework and it's around tests. And so if you get a teenager who gets concussed and they're in the middle of, like a testing season, that is going to provoke symptoms. They're going to be worse.
Yeah.
And, a lot of these kids are going to school and they're having headaches, because they had to take a test or they had to study. And it's a vicious cycle. So that's something you have to take into account when you're treating concussions in adolescents, is if they're in school and how that's going to affect their symptoms and flaring. And then the other thing is that they're going to need a lot more rest. They need more rest anyway because their brain's not developed until they're about 25. And, most, teenagers is sleep deprived from studies.
Right.
And so when they get hit and, have a concussion, we've got to focus even more on rest. And then probably one of the more challenging things for them is dietary recommendations, because teenagers are notorious for, not eating the healthiest of foods.
No, really?
Yeah.
There's pizza rolls and what have you. Last episode, you talked. You did touch on diet versus keto versus Mediterranean. What do you recommend for adolescents?
Yeah, so we try to get adolescents to eat more of a Mediterranean diet because it's not restrictive like keto is. There's not all this testing and, macros that have to be done to get it right. It's pretty simple. You can just eat fish. You can eat, a lot of the salads that you find in the Mediterranean diet, some of the pasta dishes as well. And so we find that that's a much easier diet for them to follow. So Mediterranean is what we recommend for them. And, a lot of these, pediatric patients, adolescent patients, if they don't usually have other underlying health conditions, so they're usually going to heal quicker than, let's say, an adult or a geriatric patient.
Let's take a typical high schooler going through let's just call it concussion protocol. They are recovering from a concussion. Are there any advice then on how they should plan their school day, knowing that they are recovering from a concussion?
Yeah, that's a really good question. So you would want to make sure that you decrease screens, really. That's a big one. Maybe taking the phone away or limiting the phone to only using it for necessary actions, which really would just be like a phone call or maybe like a text, right?
Sure.
To parents or family. That would be one I would recommend, getting rid of video games during this time, removing screens, as much as possible, limiting screens only to homework as well would be the biggest recommendation I can make. And then also just, prioritizing rest. So maybe scheduling rest times in between tasks throughout the day. So really just trying to, get a 30,000 foot view of a schedule and making sure that there's rest in the schedule and that we're removing screens and kind of taking it back to the old days where we're, like reading, textbooks and things like that instead of, on an iPad.
I wonder if that's something that can be scheduled into a student's day where you take a trip to the nurse's office and I need a 15-minute break, rest during my day, maybe even during the lunch hour. I need a rest during the day, and I don't know, would that be helpful?
I think that's actually a really good idea. I may actually try that on future cases, by coordinating, care with the nurses at the school districts to give them the rest they need. That's a really good idea.
Let's get into adults and senior adults. Now, the difference you mentioned with the adolescents, more diet. I'm sorry, Mediterranean diet, more rest, and the school implications. But obviously, adults and seniors do not do that. What are some of the recommendations for adults? And when I say senior, let's talk about those that are perhaps in retirement and beyond.
Yeah.
When it comes to recovery.
Yeah. So with adults, I mean, the first thing that you got to realize is that, they've lived long enough to have maybe some metabolic issues. And then when you look at, the health of the American population, overall, it's not very good. And what I mean by that is that they're traditionally inflamed. So a lot of Americans are inflamed, and that's going to create a problem for their recovery. So we really have to work on inflammation much harder in an adult because it's been there for longer. And then we also look out for other metabolic conditions like thyroid problems, infections that we don't know about, any metabolic problem that could decrease their ability to heal. And so, maybe doing blood work to find those conditions. And then the other thing you have to consider is for them, keto diet's probably going to be a better option because we need to knock down inflammation fast, really fast and aggressively. So keto diet's going to be a better option. And then they have, the work load that, of their career that we have to watch out for,
Right.
And we also have to look out for the workload of being at home, raising a family. And so how can, their spouse, if they're married, kind of help them in that regard to take some, work off of them in the house? And then how can their job maybe, modify their workload to decrease the stress that they have, in their career? And so that's kind of how we look at the lifestyle factors when we're taking care of adults. Now, when you go to the retired population, it's a totally different game. And really it's because, when you're older, you already have degeneration in your brain, in your body.
Right.
And so their frontal lobes are already not as healthy as they would be if they were younger. So we know that they're going to heal slower.
Well, that makes sense that any type of injury, a 20-year-old is going to heal faster than a 60-year-old.
Exactly. So we just have to know that up front so that we can set expectations with them that, this is going to take longer. There's going to be greater comorbidities. So, for example...
Wait, what?
Comorbidities.
Which is what?
It's another condition that they have been diagnosed with. It's going to affect the treatment of this condition, a concussion.
Gotcha.
So some people will experience this. It's more typical in the older population. For instance, I have a concussion patient currently right now who has a liver problem. We don't really know what the problem is yet, but we do know that it's holding back a recovery from the concussion because their body is not able to detox appropriately.
Going back to inflammation, can I just take a leave every day and hope that reduces the inflammation?
That wouldn't be a really good idea. Yeah. I mean, in the beginning, you could take, NSAIDs to help with the symptoms, but it's not a good long-term strategy. And there's also some studies that show that taking NSAIDs, specifically like Aleve, ibuprofen, can actually lead people towards chronic pain. So, diet's a much better option.
And to the listeners, yes, that was a sarcastic question, but a serious question. And that from the research I've done, ibuprofen's not really good for the stomach. No? Okay. Any other recommendations then for whether it's for adolescents, for adults, for seniors when it comes to recovering from a concussion?
I think the biggest one that I see is that because it is an invisible disease, right? It's not something you can get an MRI for and then say, oh, yeah, you've got a concussion. It's right there. I see it in your brain. People don't really understand it, right? And because they don't really understand it, they don't take it as seriously as it is. And so people need to really understand that when you get a concussion, it's a serious problem, and it takes a serious amount of effort to get better. And that includes, the regimen of rest and all these other lifestyle factors that we've talked about needs to be at the forefront of their mind if they're looking to get better. And finding the appropriate provider to work with is very important. And it may not just be one provider. You may need multiples because there are many comorbidities, as we discussed, that may need to be treated with other providers to get somebody truly better from concussion.
Let's talk about how people can reach out to Dr. Joseph Adams if they have more questions, not only about concussions, but going back to our earlier series as well. How do they reach out to Dr. Joseph Adams?
Yeah, you can find us at calibrationmansfield.com, and we're on pretty much every social channel that you can find as well. So just searching for us is going to be really easy, and we have a good amount of content on our YouTube channel around this as well.
CalibrationMansfield.com. That is Dr. Joseph Adams. That is another episode, a 10-minute nugget of information from the About Mansfield Consumer Advice series. Dr. Joe, let's do it again real soon.
Let's do it.